All right, guys, so I've shared this document before, but the title of this video is, Are You Committing Medicare Fraud? And I think this is really important, and this is something that even though I've shared it before, I'm going to share it again. Now, the document that you see on that side of me right there, it's an outdated document. And you can find more current versions of it in the CPT guide. Get the 2020 guide in this video in the description below. I'll put the Amazon affiliate link for that guide. You want to always be using the most current resources available. But in order for me to get this video out, I just need to use what's available, and this is what I've got right now. So let's take a look at it. So guys, I'm going to do a little bit of reading for you guys right now, right? Therapeutic exercise, we're all familiar with it. We use it to restore strength, aerobic capacity, endurance, range of motion, flexibility, where loss or restriction is a result from a specific disease injury. Okay, resulting in limited function. Not surprising there. Isokinetic, lumbar stabilization, stretching, strengthening. Many therapeutic exercises may require the unique skills of a therapist to evaluate the patient's ability, design the program, instruct the patient or caregiver on safe completion of the specific technique. All there, right? Black ink on a white background, we get it. This is the example, and I think this is really where you're going to start to look at this and say, have I been doing this wrong? Have I been committing fraud inadvertently, right? So for example, as part of an initial therapy program following a total knee replacement, a patient may start a session on an exercise bike to begin gentle range of motion activity. We get it. Totally what we all do. Initially, a patient requires skilled progression in the program from pedal rocks to building a full revolution, perhaps assessing and varying the seat height, the resistance all along the way. Okay, so initially requires the skills of a therapist or an assistant supervised by a therapist, especially like acute post-op. You know, the incision isn't healed, the dressing might still be on there, you're looking for signs of infection, for signs of excessive swelling, maybe a blood clot. There's a lot that needs our direct supervision. However, once the patient is able to safely exercise on the bike, no longer requiring frequent assessment and progression, even if setup is required. So at this point, we're saying, okay, they're safe to do it. Even if they can't get the bike going themselves, they can still do what needs to be done. The bike now becomes an independent program and is no longer covered by Medicare. While the qualified professional ancillary service personnel may still require the patient to warm up on the bike prior to therapeutic interventions, it's not considered, it's considered non-skilled, unbillable service and should not be included in the total time code treatment minutes. Non-skilled interventions need not be recorded in the treatment notes because they're not billable. However, notation of the non-skilled exercise may be reported if documentation indicates that the service was non-billable, not included in the treatment minutes. Okay, what does this mean? So every patient is going to be different. Every therapy provider is going to be different, right? We're all going to have kind of different guidelines and criteria. I can tell you that there's individuals that will come into my clinic. I'll have 2, maybe 3 sessions where I set them up on the bike. We make all the adjustments. We review. We make sure they're safe. One of the biggest risk factors, truthfully, in the clinic is patients falling, getting on and off equipment, right? So that's huge liability there, but it's still not covered if they can do the bike safely, independently. So your clinic is gonna have to make these choices for themselves. One patient might take 3 sessions, another patient might take 6 sessions, probably much more than that. We're dipping a toe in the water of overbilling, overutilization, and potential Medicare fraud. Guys, I know what happens in clinics all across the country. I've seen them, I've been in them. I can't use ignorance as an excuse, and I don't think you can either. So I want you guys to go get the CPT coding books. I want you to read the guidelines. I want you to fully understand. Reach out to your MAC, your local Medicare provider, for any kind of documentation and support, because you have to know, just because you don't know you're breaking the law doesn't make you exempt from breaking the law. Guys, was this helpful? Did this expose you to any kind of new information? Was it frustrating? Because I think for a lot of you, this is going to be frustrating news that's going to make you rethink what's been going on. Any of that, post in the comments below, subscribe to the channel. If you want me to keep producing this kind of content, I need the channel momentum to grow. I need more subscribers. The best way you can support me producing this kind of information is to subscribe and get your peers to subscribe. Okay, guys, I'll let you go. I'm going to work on my next video. I'll catch you on the next one.